So, you ready? Thank you, everybody, for joining us today. Dr. Gupta has not abandoned ship. She is getting a root canal. As you know, there are many things that are being shut down and hours of operation changed, so our health commissioner is getting a root canal right now. As we go forward with this process and as we really take this fight to COVID-19, part of what we're trying to do is mitigate not just the public health element, but the economic ability and the economic damage that's been put on our economy. So today we're going to announce a Phase 1 Economic Development Initiative. It's the Onondaga County Small Business Bridge Loan Funding Program. We are going to have a revolving fund of $500,000. This is going to work with the timing of the SBA loans that have now been approved in New York State. Right now, for small businesses, when they go to the SBA to apply for the emergency loans, they apply. At the same time they apply there, they send their application to the County Economic Development Office. On day 20, you receive an approval letter from the SBA. You get an approval letter, but you don't actually get any cash until the loan closes 60 to 90 days later. So that creates a 3-month process is a hardship. So what this process will do, on day 21, you bring us the approval letter from the SBA. We will close a short-term loan with each business and work out what a number is. We're not if the business is applying for $500,000, we're obviously not going to be able to give $500,000. We'll figure out what the necessities are for the next 60 days that we can help complement, and then we will give a short-term loan dispersed, and then on day 91, after the SBA loan is closed on and you get the proceeds from that, you'll pay back our Onondaga County loan. So this is a bridge loan funding program for businesses in Onondaga County to help in that wait period while they're waiting for the SBA loan program. The mayor talked about the SEDCO loan program yesterday. There will be more and more initiatives coming out when we see the overall economic mitigation plan from both the federal, the state, and the local level, and we look at further ways we can complement and fill those gaps. Going on to some updates. Earlier today, we did at our noon update, we updated the community that we had 6 new cases. We still only have 6 new cases. Out of the 6 new cases, 3 of them are related to a previous case, and those individuals were in quarantine. Out of the 6 new cases, 3 are female, 3 are male, 2 are under 40, 2 are middle age, and 2 are elderly. I did not write those last 2 talking points. We'll try to get more clarification on the decades. These are evolving topics. My staff forgot I'm a politician, and I don't ever want to get into trouble like that. So, okay, we'll get more specifics on those ages. I think what's important to note is that the 3 that are new, that were under quarantine, anyone who is under a quarantine right now, there's a high anticipation and expectation that they will test positive. So some are not testing positive, but that's the process here. If we're putting you under a quarantine, the reality is you've had some sort of contact with somebody that deems that kind of reaction from our health department. And certainly that's important. I'm going to touch on a release that we sent out earlier. Again, the health department sent out a release related to one of the positive tests. They were an employee of America's Best Contacts and Eyeglasses at 3401 Erie Boulevard East in DeWitt. Members of the public who visited the store during the following days and times may have had some exposure. Monday, 3/9, 8:30 to 5:30. Tuesday, 3/10, 9:30 to 6:30. Wednesday, 3/11, 10:30 to 7:30. Thursday, 3/12, 9:30 to 3:30. We're asking that if you had any if you're at that store during those times, and certainly if you have any symptoms or sick in any way, please contact your primary care provider and or the health department after your primary care provider to report that, and your doctor will determine whether or not you should go get tested. But certainly, this is a type of example as this process continues that we will ask the public for help, and we will ask and share that information with the public. Related to testing, right now we have the Syracuse Community Health Center. We've been receiving testing results throughout the day. This is the big site where we did the surge testing site. This is where all the a lot of the action is in the community, over 50% of the action. Right now we got 95 tests in today, all negative. So overall, we have 13 positive. We anticipate, and again, this number is evolving, that there's been 425 total tests where we received results back, and 13 of those were positive in the county. These, as a reminder, we're getting testing is being done at our 3 hospitals. Crouse and St. Joseph's has more limited testing they're doing. Upstate is still doing testing. The primary care providers are still doing testing, and certainly over 50% of the testing is being done at the testing triage site, which is good. The triage hotline's been busy, over 4,000 calls coming in. I think needless to say, our friends in the media are doing a very good job on this. The public is informed, the public is reacting. If people are sick, they're calling their doctors and they're calling and asking good questions. This helps us because if we can test as many people that may have symptoms, that's how we identify those who are sick and those who need to be quarantined. That's how we really starve out this virus, and we make our curve that much flatter than what some of these other communities are seeing. Also related to that, the mandatory quarantine we talked about earlier. The mandatory quarantine is mandatory. If you're put in a quarantine or you take a test and are waiting the results, you're under a mandatory quarantine. If you need help, we're here to help you. You can contact any of our numbers and just say, you can contact this number right here, our 315-218-1987 number. Certainly, if you need meals or you're having a hard time, your continuity plan has fallen because your continuity plan or people that are now under quarantine, we're going to help you. You're our neighbors. You didn't do anything wrong. We're going to help you. We want to emphasize, again, the social distancing with our young people. Today's a great day. I haven't gotten a report yet from the parks. We don't mind you using the park system. It was busy yesterday. Get out and use the outdoor facilities. I had an email saying, why aren't the bathrooms open in Onondaga Lake Parkway? They're not open because we don't want you in them. That's why, and because that's an area where you could have community spread. So if there's state parks that have the bathrooms open, that's their call. We don't want people in the bathrooms. We have the parks open as a mental health refuge to take advantage. They're your parks, but at the same time, we're practicing social distancing. We also have expanded the senior nutrition line, which is for this independent senior class that can no longer travel outside their home, to a line for medical workers or healthcare workers that are having a hard time getting materials. So that's there. If you're working the night shift, you come home, you wake up, you go to the store, you can't find diapers for your kids, there's certain food products you need, and then you got to go to work and you can't get it and you're getting low, call this line. We'll help you. Daycare. We now have over 1,000 daycare slots available for our emergency management and emergency responders. In addition to that, healthcare workers. In addition to that, we can now open this up for emergency response for our essential businesses. If you have a collapse in daycare, you're essential now. We have the slots available. For our first responders and medical personnel, these daycare slots will be free of charge. Volunteering, we want to continue to continue to ask people to volunteer at the United Way, 315-428-2229. If they don't call you right away, that doesn't mean your name's not there. We're getting access to the volunteer list, and as we build out infrastructure to meet the ongoing demands of the public, we're putting people with their proper skill sets into these plans. Again, medical professionals, we need you to reach out as volunteers as well. Our website there, ongov.net/medical volunteers. We really need to start building up this list as we continue to plan for the worst case scenarios that we see in other countries. We need to really have a good idea of what kind of volunteers we have with medical credentials. So we really ask you to volunteer. Certainly, if you're in an age bracket where you would be more prone and more susceptible to the virus, we'll have you volunteering in ways that undermines your safety, that looks for your and addresses your safety, not undermines. Also, we want to encourage businesses, our residents to continue to support our businesses, our restaurants. I think we're talking about it, maybe an outreach program where we have like a takeout restaurant week with specials. Let's keep these restaurants busy. It's Friday. Everybody, I don't believe anybody if they say they don't order out on Fridays. That's what we always do. I'm sure we're not the exception to the rule. Let's continue to order out and certainly keep these folks busy. That's going to help our economy and it's going to help keep our food supply chains active. Saying all that, I'll take some questions. Yeah. Yeah, I think what's the math say? We're at 2 or 3% right now. It's not bad. I think this triage site. The first few days, we're testing a lot of people, and so now We're starting to see that curve down a little bit, which I think is promising. I don't think that people aren't. I think people that need to get tested know how to get the tests and are taking it seriously. Now the next phase is, once we find the positives, making sure that the quarantines hold up and people follow the quarantines, and eventually some of those in quarantine will be positive. And then, but once you go into a quarantine, our health department starts investigating you at that time, who you may have had exposure to as well. So right now I think it's really about we got ahead of this, right? And so we're ahead of it right now. We're still ahead of it a little bit, but we have to keep our health department really doing robust investigations, figuring out and connecting all the pieces to the puzzle. We got to keep our emergency rooms for emergencies outside of COVID-19. And now we're planning for next step planning for other surge sites. We had plans for more testing sites. I don't think right now that's necessary. But if it is, we have those plans and we're ready to implement those plans if we have the supply chain.
Now that we're completely shut down, it seems, all non-essential people are
Yeah.
supposed to stay home from the new order by the governor. 2 weeks from now, should we expect testing and positive numbers to drop? Because you talk about starting the virus. If people are always
Yeah.
practicing social distancing, not going to work anymore, will the virus be started in 2 weeks?
I think the numbers should go down, Andrew. I think that's what we're starting to see. I hope that's the trend we'll continue to see, is that these numbers, the number of people needing tests starts to go down. And then certainly at some point you'd like to see it be a 2-mile run and then start to go home early instead of the marathon run up the hill. So I think it's too early to tell. But again, the policies being implemented are doing that. Spread everybody out, keep everybody out of concentrated areas. That makes it harder for the virus to jump around. But it's too early to tell. With all the testing we've done, we'll get a picture of a story of how bad that virus has infiltrated our community initially, and did the policies that have been put into place work to the effect where it flattens the curve and it starts to come back. Yeah, right now we think we're good through tomorrow. We're still working with some partners. to get some more. Each day we've been running around and chasing down supplies, and hopefully we'll be ready. I think our supply chain should be good through tomorrow today, which is actually a little bit more time than normal. So hopefully we'll be able to later today say, yeah, we know we'll be good through Sunday, but we'll know that tomorrow.
For medical volunteers, they're going to call out the doctors and other specialties over your
Yeah.
consideration of maybe some residents in upstate.
Yeah, look at a lot of these professionals are doing elective surgeries. They're not going to be doing those anymore. So if they want to step up, we need them to step up, and that's what this is about.
We've seen Oneida and Madison counties reduce testing for the most, preserving it for the most vulnerable people. So there might be people that are contagious but are just asked to self-isolate. Do you foresee that happening in Oneida?
That we don't want that to happen, right? And if you're from Oneida or Madison, you guys might have heard about my friend Joe earlier today. You can drive into Onondaga County, right? There's no barrier, right? You could have a community spread. So we want the infrastructure of all Central New York to hold up, and the test kits are now a challenge. We've been able to. There's a recognition from FEMA and the state that. And again, we'd like it to be a stronger recognition, but that we're servicing over 1 million people as far as our medical infrastructure goes. So we're a pretty important player in this fight when you look at the rest of the state north of the Hudson.
Are you inviting people in those counties to?
I'm not inviting anybody. The way that the capitalism and society works is that if you have a doctor, and you live in St. Lawrence County and you want to see your doctor in Syracuse, New York, you get to do that. And so if your doctor's saying, I'm going to give you a test, they have an oath to your health, and we have an oath to the public health. So I'm not inviting anybody in to do anything except that we're not going to turn away someone who's sick, who came into our community. That's stupid. They can go and they can stop at a gas station on their way home or stop somewhere else and then create more sick people. So we want to address this issue. You can't address this issue in a vacuum. If we were an island, it'd be easier. We're not an island. We're in the middle of the state, and we have the most robust medical infrastructure in upstate New York. So people from all over the state are going to utilize us. So we have to look at this as we're being good partners to New York State, and we're being very good partners to the country overall.
But would you call your counterparts in those counties and say, don't publicize that people should stay home and not get tested because they're not as at risk? Instead, why don't you bring them or send them to Onondaga?
I haven't seen these reports, Andrew, so I would have to look at the reports and what leaders are saying to really comment on that. Yeah, I think it's safe to say, Chris, that we're probably getting north of 2,000 overall in the community. I haven't gotten the reports yet on what we've done today at the triage site yet, but each day we're at least 50% at that site, and then everybody else adds on to it. So I think it's safe to say we're getting close to 2,000 overall, if we're not over there already. Melanie, how many do you got? Do you know? No? We'll get you the number on how many you got, the health department has. But related to capacity is a concern with everything now, right? So that's why we can't have people calling up screaming at our health department. That's why they're an essential department. We haven't thinned out those numbers. And why we're looking at complementing some of the things that normally our health department would do with other medical volunteers, so that we can have our investigators out and put more people that are familiar with that process into that process. So right now, certainly, we are getting our investigations done and in a timely basis, and we'll know really soon whether we're going to see what kind of spike we'll see in positive cases, as there's an influx of tests that are coming in today, tomorrow, Sunday. Yeah. Yeah. So you got 3 to 4 at the surge site. Quest was doing 3 to 4 days, right? So start Monday. We're starting to get the first wave in now. Saturday and Sunday, you're going to see other large waves, so we'll have big numbers tomorrow and Sunday for you. And then that will go into Monday, and then you'll start seeing, as the tests go down, the overall, the numbers will obviously flatten out.
What should people at home know if they see that this weekend the numbers are going to go up? How do you calm some of those fears?
Yeah, we expected it. So I think we got to look at this as a percentage basis and look at what's normal and what's happening. So you stay within a percentage that's within the national and state average, or you're a little above some days, you're a little below other days. That's expected. I expected that we would have a higher number when I was talking to you today. We don't. Sometimes you get some surprises, and we go from there. But right now, we're ahead of this still. Things are okay. People are going to get through this. We're going to get through this as a community. There would be other people in that number right now because upstate. So those are all the tests performed for anybody tested in any facilities in Onondaga County. Correct.
Moving forward, you guys put out the information about the Vision Center today. What's the process going to be with these positive cases about what information is relayed to the public and what's kept quiet?
Yeah, we gotta protect the privacy rights, and so we're gonna give the information which is necessary to the public for the safety of the public when we need the public's health, but we're not gonna out a patient. And once there's too much information that can be given that would then out a patient, we're not doing that. And so I don't even have all the information that you asked for. I don't even know the answers. Dr. Gupta doesn't give me those answers. So we got to be careful with that. Oh, okay. If there's 20 investigators and more staff are being trained. Yes. One more question. As soon as our health department deems that there's a gap in their investigation. So that, in this case, it was within 30 hours. Right. So this case, I think, Chris, is about 30 hours before the press release went out.
So why was that same information not given to the person who was here?
There was no gap in the investigation. They got the answers they were looking for. They got the people they felt needed to be in a quarantine.
For the people who may have been at this eye care center, can they protectively self-quarantine?
They want.
If they're panicking tonight, just tell them that what's the likelihood of contact?
Yeah, I'm not going to get into the likelihood of contact. I think if they believe they're in that store, they should contact their doctor. Okay? No, we're going to have a briefing again tomorrow, and 3 o'clock. We'll go over everything, and we'll have all the accurate information, and we'll go over all this again tomorrow. Hey, it's more negative tests are coming back than positive tests, and we're getting through this. We're getting better at this. The public's responding. Okay, thanks, guys.